Let's now focus on COVID and concerns in the national capital. Now, Delhi has reported 5 COVID-related deaths and 2,073 new cases on Wednesday. And the worry is that the positivity rate has remained above 10% for the third day in a row.
That's right. And the positivity rate yesterday, Gargi, was 11.64%, which is the highest since January 24th, when it was 11.79%. And another point of concern is the daily new cases. The 2,000 mark has been crossed for the first time since June end. So the concerns for COVID are rising, and there are many questions that all of us will have on our minds about the symptoms and also about the testing now.
All right, well, joining us, we have a panel of doctors. Doctors, welcome once again to the show. We have Dr. Rajeev Jayadevan, member National IMA Task Force on COVID, Dr. Romil Tikku, Associate Director, Internal Medicine, Max Healthcare, Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine, Indraprastha Apollo Hospital, and Dr. Vivek Nangia, Principal Director and Head Respiratory Critical Care Medicine, Max Saket. Well, thank you again for coming on to the show, and this over the concerns over COVID, rising in Delhi. And the concern also is because what we see happening in Delhi, then we often see, happening in the rest of the country a little later. Dr. Jayadevan, first, if I could come to you, how concerning is this rise that we're seeing in Delhi currently?
It is only an expected phenomenon because COVID-19 is a cyclical disease and it will continue to come in waves for a very long time. It does not affect all parts of the country at the same time. For instance, a part of India that I work in right now, the TPR is down at around 9 from 18 that it was a month ago. And in Delhi, the opposite trend is seen. The good news is that if I can call it that, is that the hospitals are not overwhelmed at any point. Most people are able to be managed at home, but what it does do is that there are a lot of people who have a lot of medical conditions who are barely coping at home, and when COVID happens to them, they destabilize and they end up in the hospital. And so we must be careful not to let this virus spread unchecked in the community.
Right. And my next question to Dr. Romil Tikku, what we are just looking at is the positivity rate. It's above 11% in Delhi. So do you think the tests are not being conducted to the measure that they should be conducted, and there could be many more cases that would have been gone untested?
Well, it's not about the tests anymore. Majority of the patients are getting tested at home. They're doing a rapid antigen at home. Because the disease is mild, a lot of people are complacent. If you go out and see, nobody's wearing a mask even now. The virus is not yet dead and gone. We have to be extremely careful. As the other panel members said, we might not get it. We might be young. Yes, the whole country is almost vaccinated, but there is a vulnerable population still at risk. So we have to save them. And it's not about the tests anymore. Yes, the positives remain, that the hospitalization rates are pretty low. And we're not seeing hordes of patients getting pneumonia, going for the CT scans and steroids and the side effects of the steroids. All that is not happening. But yes, there's a cause for concern. We don't have to panic, but the rates are steadily going up, especially in Delhi, from 1,000 odd for 5 days to 1,200, 1,500, 2,000. So we have to wear a mask. See, all these things will happen because in a huge country like ours, there will be ups and downs. And the impact of the vaccines waning down in the last 6 to 9 months, and the fact that the new variants are emerging, the variants, sub-variants of Omicron, these things will happen. We have to take it in our stride, but we don't have to let our guard down. We have to wear a mask even now, and we do have to take all the precautions. And the ones who have to take their booster dose have to take their booster dose. Yes, you might be getting tested at home. The disease still remains mild. Majority of the people who are getting infected are infecting the entire household. But the fact of the matter is that they are not reporting to the hospital, they're not getting pneumonia, and they don't need hospitalization. As long as that's happening, we'll be able to manage it. But having said that, the virus is here to stay for some more time, so please don't let your guard down.
Right, Dr. Nangia, so this as predicted, over 2 years ago that this virus would become something that, we'd see coming again and again. So what is different this time around? And, you were talking about the different types of the virus and how it's mutating, etc. So has it weakened now? What would you say about that?
See, basically, Gargi, what is happening now is that the infectivity rate is still very high, but the severity of the symptoms is milder now. So the disease is mild. It usually starts with a sore throat, cough, cold, and fever, body aches. But what we are seeing this time around is that the fever is lasting for 3 to 5 days, is a much higher grade than what we were seeing in the Omicron variant in January and February this year. So there are some changes in the manifestations also that you need to watch out for. So people do get bogged down with the high-grade fever, which is persisting for almost 5 days this time. And positivity is also remaining for a much longer period. So what is very important besides, as Dr. Tikku said, wearing masks and maintaining all those precautions, is to isolate themselves on day one itself. You know, the day they develop a sore throat or fever or body aches or cough, cold, the first thing they should do is isolate themselves. You know, this is not only for their own benefit, but also for the benefit of the people around them. It's a kind of a social responsibility that we all have. What is happening is that people, despite running cold, cough, fever, they're roaming around in the society, coming to the hospitals, waiting in the waiting area, spreading it to all other people who are waiting, coughing without covering their faces properly, without wearing a mask. So that is what I think, if we start doing that, we'll be able to bring down this percentage to a large extent.
Right. Important message there, that isolate the day you start developing symptoms. Doctor, you also mentioned the variants. And if I can get to Dr. Suranjit Chatterjee on this, is there any new variant, any concern of a new variant now, or is the Omicron wave, the Omicron variant, still dominating the COVID cases in Delhi and across the country?
See, I think it's the Omicron variant which is obviously dominating the entire country. But yes, the genome sequencing has to go on. As Dr. Nangia has said, that we are finding slightly different symptoms, slightly more severe, like the fever persisting for a long time. It's not obviously affecting the lung, or they are not requiring hospitalizations, but there are definitely minor changes from the time what we saw in January, February. So the genome sequencing has to go on so that we know what variant we are dealing with. In all probability, we are dealing with the same variant. The good thing is that a huge population in Delhi is vaccinated, and that's why the severity of the symptoms is much less. The hospitalizations are much less, but we need to be careful. Obviously, as Dr. Tikku also said, that we don't need to panic, but we need to be aware and following all the measures that we have been saying for the last 2 years.
All right. And Dr. Tikku, you know, earlier when we used to talk about the COVID, we used to talk a lot about long COVID and the various impacts, you know, post-COVID on the heart, on, you know, various parts of the body. And, you know, while we're saying that this disease might be milder this time, etc., are those concerns still very valid? We don't know how it's going to be affecting our body in the long term. You know, people we know around us, we know have had COVID twice or thrice as well.
Well, yes, the concerns are still valid, because we are seeing a lot of patients who had COVID in the past 2-3 months still having extreme fatigue, breathlessness, insomnia, restlessness, panic attacks, GI symptoms. Most of them have lost some weight, some vomiting, some diarrhea happening on and off. And we don't know how it's going to unfold in the next few months or years, because each variant is different and how it impacts your system. Yes, there are no major complications. We haven't seen cardiac issues, neurological issues in every other patient. But yes, definitely fatigue, some sort of breathlessness, loss of appetite, insomnia, all these things we are seeing. That's why we have to be extremely careful. You might get a mild disease, but you don't know how it's going to unfold once you've recovered from the disease. You might get a long COVID, which might land you in trouble. It just affects your quality of life. That's why it's very important that we should not get infected in the first place.
Right. And Dr. Jayadevan, if you would like to add anything on long COVID and the symptoms really persisting after testing negative, and also another concern being the testing. Earlier, we would only consider the RT-PCR test as credible, but now, of course, we have home testing. And some people are saying that those come out with false positive results or false negative results. So how trustworthy are those home testing kits in comparison to RT-PCR?
First, about the testing, Priyanshi, the first few days, you are likely to get a negative test in spite of having infection. And that's well known ever since the onset of Omicron, particularly so with antigen testing. So you might turn positive on day 5 when you were negative on day 2. So that's not uncommon. And people tend to be staying positive a little bit longer. You saw U.S. President Joe Biden testing positive today on day 14 of his illness, agreed that it was a rebound case. The second point you raised was that of long COVID. That's an important message here for the community. Many people are under the impression that the more infections you get, the better immunity you get. And that's a common myth, and that's completely wrong. It's like, suppose, God forbid, we fall down and break our leg and we heal. The next time we fall, there is no guarantee that it's going to be milder. I think every COVID episode must be treated on merit. And there is no guarantee that it is milder or more severe. It is true that the vast majority are mild, but repeated infections are going to take their toll, particularly on people who have who are slightly older and who have coexisting conditions. So it's an important message, as the other doctors have said, that we must realize that there's an airborne virus that is here to stay, and we are living in a world that is infested by a virus that we can't get rid of.
All right. Well, on that note, we'll have to end this discussion. But thank you so much, doctors, for being with us again and, raising the concerns and telling the viewers what they need to watch out for, given that, as we said, what we see in Delhi, we often see then, in other parts of the country in subsequent weeks and months. Thank you for joining us on the show.